Members of our community, I want you to know that this is in fact a Republican shutdown. Since the beginning of this administration, House Democrats have been clear that we want to negotiate. We want to send a bill to the Senate that makes sense for the folks in this country, not just Democrats, but all Americans. And the number one demand then and now is to save health care. The big ugly bill will, and this is by nonpartisan analysis, will take health care away to 15 to 17 million Americans, 30,000 in this district in the next 10 years if it passes. The Democrats have been clear that we're ready and willing to negotiate to open back the government, but our calls have been unanswered. And so while the Democrats continue to hold the line for the people of this country, the Republicans continue to not answer the call. I'm proud to stand with these mayors, and today you'll get a bit of a taste of what we're doing collectively and what they're committed to doing to holding up the safety and security of their residents in their own district. Together, through the shutdown and through the threats of the militarization of our communities, our mayors are united. They're clear in their mission that safety, security, and really the establishment of a coordinated district is their highest priority. With that, we'll be introducing mayors from the region, and I'll start with Mayor Barbara Lee. Mayor Lee.
Thank you very much. First, let me once again thank the press for showing up and being here with us to communicate our message very clearly about the truth with regard to what is taking place in Washington, D.C. and its impact on us here locally. I want to thank our Congresswoman, Latifah Simon, for staying the course. You know, I've been through several shutdowns, and from day one, we knew they were trying to repeal the Affordable Care Act, and it was Senator John McCain who cast that vote that maintained health care for everyone. Here we are now, once again, trying to save health care, and thank you, because this shutdown and the fight that you are mounting is not only for low-income people, it's for everyone. It's for middle-income people, people who don't deserve to have their health care insurance premiums raised. It's for people who have family members who are seniors. It's for everyone. And so this is a fight that we have to stay the course on, because our district, my city, is going to be impacted tremendously as it relates to health care costs going up tremendously. A couple of things I'd just like to mention. First of all, here in Oakland, thousands of federal employees will be living and are living right now and working, though, without pay, creating a financial hardship. A lot of families are depending on essential services, and our essential workers are being impacted also. We have 2 federal buildings here in Oakland. We have local businesses who are feeling the ripple effects as federal workers reduce spending, the hurting, of course, and the pain is being inflicted every single place. There is a ripple effect and impacts that are being felt and seen that people don't even recognize. Also, when you look at the TSA agents at Oakland Airport, for example, working without pay. They're essential, though, working without pay. Many Oakland residents, of course, rely on SNAP benefits, and I want to thank our county for stepping up and making sure that our food banks will be distributed, food will be distributed to those who are most vulnerable and who need basics just to eat. Also here, SNAP benefits, as I said, they're running out. And so we have to stand in the gap, and that's what all of our mayors are doing here. We're standing in the gap with our Congresswoman. Head Start, I just want to mention Head Start because that's a growing concern here in Oakland. We serve primarily 3 to 4-year-old children in under-resourced communities, and their funding is administered through the city. Normally all the funding comes from the federal government on November 1st, but it's likely to be delayed if the shutdown remains ongoing. And there are many, many other economic impacts, but the impacts on the most vulnerable people who even are working. We have many people here in Oakland who are low income, who are part of the working poor, who rely on their city to help, their federal government to help just making sure that they're able to survive, not even to thrive. We want people here in Oakland to thrive. And so this is negatively impacting so many people in so many ways. And all of our mayors here, we're a region. And so what affects one is affecting all. And so thank you, Congresswoman Simon, for bringing us together, and look forward to any questions later. Thank you again.
Thank you, Mayor Lee.
Okay, next up we have Berkeley Mayor Kishi.
I want to start by thanking Congresswoman Simon for gathering us here today. I think it's so important that we present a united front. People might be living in Oakland, but they could be working or going to school in Berkeley. We know that people live and work and play and pray across the East Bay area. We already know who's going to be hurt the most by this shutdown and who is being hurt right now. It's the people who have already been suffering in our community. We're particularly concerned in Berkeley about WIC benefits, SNAP benefits, food insecurity generally. We know that our Berkeley Food Network is doing everything it can right now to prepare for what's going to be happening. We're also concerned about health care. And so at the same time, we understand why we need to hold the line here, why it's so important that our Congresswoman is fighting for us for health care, because we shouldn't have to pick between health care and food. We shouldn't have to pick between the basic necessities. Already, there are people who are suffering in our city, and we know that the impacts are going to be felt throughout. So we really think it's important that we continue to fight. We think it's important to hold the line, and we know that we need to step up as a community to make sure that we're continuing to serve people and their basic needs. Thank you very much. Appreciate you hosting us.
Thank you, Mayor.
Next up we have Alameda Mayor Ashcraft.
Thank you. Good afternoon, everyone. And thank you, as others have said, to our fabulous freshman Congresswoman, Lateefah Simon, who hit the ground running on day one, took up where her predecessor, the great Barbara Lee, left off. I am the mayor of the city of Alameda, and I want you to know that the kind of assistance we need from the federal government is not to send troops to Coast Guard Island that is a part of Alameda. What we are looking for is funding that, in fact, we have already been granted, for example, to keep our roadways and streets safe, to do complete streets, safe streets for all, to keep our children, pedestrians, bicyclists, and motorists, public transit safe and moving. Those grants, the ones that have survived the clawback, are now paused during the shutdown. And it's anyone's guess when that funding will resume. In addition to that, excuse me, Alameda is an island, but the entire region needs to be concerned about climate change and sea level rise because, as I like to say to my fellow electeds, even if you don't live in a waterfront community, if we don't do something about climate change and sea level rise, you will. But the city of Alameda and this region, we do work collaboratively together. You have before you half of all mayors in Alameda County because we're a county of 14 cities. Alameda has worked collaboratively with our next door neighbor cities, Oakland and San Leandro, but 30 other stakeholders to address climate change, sea level rise, and how we can mitigate the impacts without unintended consequences to our neighbors. So, for instance, we're working with Caltrans, the Port of Oakland, East Bay Regional Parks District, tribal communities in the area, and more. Working together in the last administration, we jointly applied for and were awarded a $55 million FEMA grant to address these mitigations. It was a game changer until that program was ended by the current administration. We have some hope that it's coming back in some other form because who knew even red states have climate change impacts. But we very much are feeling just what grants we did have to address climate change, everything's been frozen for the moment. Adina Ishii, mayor of Berkeley, alluded to the healthcare impacts. We have Alameda Hospital on our island community, our only hospital. It is part of Alameda Health Systems, which oversees Highland Hospital, San Leandro Hospital, St. Rose, John George Pavilion. But we know that as people start to lose their health care subsidies or those subsidies become unaffordable, they will turn to hospital emergency rooms as their primary care providers, further burdening that system. And finally, housing is a concern to our entire region. We are in a housing crisis. We rely on folks being able to get their Section 8 housing subsidies. We rely on landlords who accept those subsidies. We have just learned from the Congresswoman that come November 1st, which is just around the corner, those landlords will not be receiving their checks to provide this housing to low-income renters. So many things to be concerned with. What gives us hope is that we are represented by Congresswoman Lateefah Simon. Thank you all for your attention and to you for your support. Thank you.
Thank you, Mayor. Next up, we have San Diego Mayor Gonzalez.
Well, good afternoon, and thank you for coming. I will not reiterate everything that other mayors have said. Clearly, the impacts are present on healthcare, on housing, on food security. Whichever way you turn, the impacts are there. What I will say is the government shutdown is challenging our very value system. Because you see that government is set up to meet the needs of those that cannot take care of themselves. Government is not here to make the rich richer. It is here to lift up the vulnerable. As someone who comes from the business world, one of the things that I know is that businesses look for certainty. And what we have right now is the intentional creation of uncertainty. That's not good for business. Created chaos is not good for our economy. And we see it in the numbers, even if folks are trying to hide the numbers. So what I hope that we can recognize is that this all actually began much earlier this year. There was the threat of a government shutdown early this year. And the decision was made to hold off, to say, let's give hope a chance. That was the decision early in 2025. But what's happened, a full year has gone by, and now it's time to call the question. So I believe, and I believe the city of San Leandro believes, and all of these people behind me believe, that compromise is not a sign of weakness. Commitment to values is not a sign of weakness. Instead, it's a sign of leadership. And so I close my thoughts by making a very simple request, and that's respectfully to Speaker Johnson, let's get back to work. Let's find common ground.
Thank you, Mayor. Fantastic work. Next up, we have Embryville Mayor Moore.
Thank you all for coming. I want to thank my fellow mayors and especially Congresswoman Simon for bringing focus to the shutdown, which is a very important issue, which normally does not need focus brought to it, but in this climate of federal chaos, so much of it being caused unnecessarily, it bears worth stating the impacts of this shutdown, which we're only just starting to feel, but they are going to be, many are interconnected, and they're going to start to be felt acutely throughout our communities. Starting with food insecurity related to the loss of SNAP and WIC benefits. As people are unable to buy food, they might not be able to make rent because they have to start making painful choices between those. And then the impacts on healthcare, which already are such a source of cost and bankruptcy among people, driving them into the streets. This is what we're trying to prevent. This is what we're trying to draw attention to. Our communities definitely don't need this. We have very real problems that we're working on, and those are the matters of good governance that we need to address, and we don't need this unnecessary chaos. So I do appreciate the focus of you all here and Congresswoman Simon to bring attention to this before things become especially acute. Thank you.
Thank you, Mayor. Next, we have Albany Mayor Lopez.
Good afternoon, everyone. And no, this is not a prank. I am the Albany mayor. I know I don't look like your typical elected, but I do want to give some background on my positionality before I give a couple statements. I have previously worked for the U.S. Department of Energy at the Lawrence Berkeley National Lab. I am currently a PhD candidate at UC Berkeley in the Department of Environmental Science, Policy, and Management. And I'm the father of two amazing, beautiful children, Melanie and Omateo. The city of Albany, I think, has a lot of misconceptions and assumptions about our demographics and what we look like and who lives there. And as I shared with my elected colleagues earlier, the city of Albany, over 50% of the residents are renters. And we have a sizable number of folks. In fact, in 2024, we just discussed this at our most recent council meeting. In 2024, we had 668 unduplicated households that relied on our Albany Cares program for support. 15%, I believe, of which, about 100 households, that was financial assistance. And so as I expressed earlier to my colleagues as well, what we are bracing to experience right now with the shutdown is nothing new. We have been dealing with these issues, especially in Black and brown communities. And so I want to be adamantly clear that we are mindful and we are aware of the struggle that people have been going through. And so I appreciate our Congressmember and all our other representatives in Congress holding the line right now. And I acknowledge that we may be encountering some stressful moments, but it ain't nothing we ain't never seen before. And I do want to emphasize, too, at this moment, that for those on the other side who are intentionally making this difficult and intentionally putting us in a situation where there will be people who cannot have affordable health care or accessible health care, that is dangerous. And I'll end on this note with a personal story that I've shared with my colleagues earlier that I seldom share, but I think it's appropriate now. That while I was campaigning in 2022, my partner, she had fallen down the stairs and had an unfortunate injury, fractured her leg in 3 different places. 3 weeks later, gave birth to my son, Mateo. And unfortunately, he was a NICU baby. He required extensive amount of surgery during his first year of life. The only reason we were able to go through with all of this was because we had access to affordable health care coverage. And it shouldn't have to take the privilege of being able to be an elected official to have access to health care coverage like that, to have the most basic needs of your children met, or any other family member, or anyone in your community. And so I want to double down and emphasize that we are in this for the long haul if need be. And I appreciate our Congressmember for bringing us together and making sure that we all are showing a unified front that we support each other. And with that said, thank you again, Congressmember Simon. Much love and appreciation to all our folks in the media as well coming out to make sure that you're distributing the information appropriately and properly.
Thank you, Mayor. Next, we have Piedmont Vice Mayor McCarthy.
Good afternoon. My name is Connie McCarthy. I'm the Vice Mayor of Piedmont. At first blush, you might not think that Piedmont is affected as profoundly by this shutdown, but we are. We have federal workers in our town. We have business owners that have government contracts. But most importantly, we are, by and large, a bedroom community. We are a small donut hole surrounded by Oakland. And I have told my 3 now adult children their entire lives, you sleep in Piedmont, you live, you work, you shop, you go to entertainment in Oakland and our surrounding cities. So what happens to our neighbors happens to us. And yes, we are our brother's keeper. So we are very grateful that Congresswoman Simon is giving us a voice, all of the mayors here a voice to amplify our concerns with this shutdown. We need it stopped. The longer it goes on, in addition to hurting families, whether they choose to put groceries on the table or seek medical care, it devalues the purpose of government. We are supposed to solve problems, and we are supposed to continue to secure the public trust. And as low as that might be in government right now, it will go lower the longer this continues. So thank you to Congresswoman Simon. We are ready to get to work and to do whatever you ask of Piedmont to support your voice in Congress.
Thank you. Thank you, Mayor. And before we go to questions, I just want to make clear, again, for the folks who came in, we brought 7 mayors together. I represent 7 cities. You have 100% support for working families and for the notion that health care, affordable, excellent health care is the floor. It's the floor. It's not the vision of what we believe we need to have beloved and safe communities. So the information that I am giving to these mayors, and I have said it, it is fluid, as the administration has done a horrific job at being in contact with members of the House of Representatives from the other side, from, again, SNAP benefits to Section 8 subsidies and reimbursements. We're hearing different things. The point of me being in the United States Congress is to support and work for
our cities. And so literally being around the table today, understanding what our mayors expect and need from our case management staff, my legislative staff, and myself, that's the job. So I want to let you all know that, you know, this will be a continuous process where we're working with our mayors, we're working with our city and county lobbyists to make sure that everyone has the information that they need. Lastly, before we open up to questions, while the Republicans have not been at work, my office has been open literally 7 days a week. We are taking calls. We're doing case management services to members of the public who are having concerns about immigration. Call our office. If you're having trouble figuring out what's going on with Social Security and your payments and your applications, call my office. If you're having trouble or have questions about your VA benefits, call our office. Our job is to work for you, not the other way around. And we'll take a few questions. And again, I'm hoping that the questions will be mostly directed at our mayors, since they are the ones holding up this community.
Thank you, Congresswoman. Right here.
I'm so Hassan with ABC 7 News.
Yes,
For
sir.
you 7 mayors, what are the main things that you're asking Congresswoman Simon to do, you know, right now, and once this may open, there could be blocks, hurdles to cross to get that funding going. What are those discussions like?
Please, anyone.
You know, Mayor Lee,
I'm just asking her.
you
To,
actually
I'm just
have-
asking the
yeah,
Congresswoman
yeah,
to
yeah.
continue doing what she's doing now, and that's fighting for health care for everyone, and also what she is doing now, and that's keeping us informed, because, as she said earlier, it's fluid, and we need her and her staff keeping us very much on top of what the impacts are going to be at the federal level, so that we can better fill in the gaps and stand in the gaps for people who are being negatively impacted.
Thank you, Mary Lee. I was just going to add that she doesn't have a magic wand, but to the extent, Congresswoman, that you're able to talk to some of your colleagues, because I do